I spent so many years not stretching because I was in so much pain, and I thought that part of the way to get better was to stop doing any kind of stretching. My hamstrings now are so tight, and or my nervous system is that tight. And I attribute that in part to the fact that I did not stretch at all for quite a few years because I was in so much pain. Welcome back to the Bendy Bodies podcast. I'm your host, Dr. Linda Bluestein, the Hypermobility MD, a Mayo Clinic trained expert in Ehlers-Danlos syndromes. Today, we're going to be talking to Dr. Emily Scherb, who goes by the Circus Doc. Circus performers do things that most of us can barely comprehend. They do crazy things. They bend farther, fall harder, spin faster, and train through forces that would overwhelm many bodies. But what happens when extraordinary flexibility intersects with instability, pain, dysautonomia, fatigue, trauma, or connective tissue disorders? Today, we're going to explore what circus medicine can teach us all about hypermobility and the human body. After decades spent hanging from trapezes, standing on heads, and dangling from hot air balloons, Emily traded fishnets for the clinic, but she never left the circus. Now known as the Circus Doc, she has transitioned from performer to a physical therapist, researcher, and author of the best-selling book, Applied Anatomy of Aerial Arts. Dr. Scherb was a guest on the Bendy Bodies podcast almost 6 years ago for episode 14, and we will link that in the show notes. I think this conversation is going to challenge how people think about flexibility, pain, strength, and resilience. This podcast is for education only and is not a substitute for personalized medical advice. Stay to the end for a hypermobility hack. Here we go. I'm super excited to tell you about the Bendy Bodies Boutique. I am so proud of our fierce styles and flexible designs. These are created by hypermobile artists for hypermobile shoppers. There are so many fun items from clothing, accessories, home goods, and my favorite are the bags. I especially love the Weekender tote with one of the EDS Tough designs. Whether you're shopping for yourself or someone you love, there's so many options to choose from. A portion of the proceeds goes to support EDS nonprofit organizations. For more information, please visit bendybodiesboutique.com. Well, I'm super excited to be back with Dr. Emily Scherb. I talked to you about 6 years ago for episode 14, and we will soon be publishing, or maybe we've already published by the time this comes out, episode 200. So it's kind of crazy to be chatting with you again after such a long time, even though you and I have worked on a lot of projects together.
I can't believe it's been 6 years, but it was a great conversation then, and I'm really excited for the conversation today.
Yeah, me too. For the people who maybe don't know you as well or didn't listen to that episode, can you tell us what first drew you into circus medicine?
Absolutely. So I was a gymnast as a small kid, like a lot of us were, or many people were. And I loved moving my body. I loved learning new skills and new performances. And then I found circus at a summer camp when I was about 10 or 11. And I realized that I could do all of that same skill building, all of that same movement in my body. And then I got claps no matter what I did instead of scores. And I was like, oh, this is fantastic. I love this. So definitely a performing artist, right? And so circus has always been a part of my life. And then I went to grad school and always had my eye on, okay, so this is a cool thing I learned about the body, but how does it relate to this passion of mine of circus, where I had been working prior to going to grad school? And I kept kind of trying to make those connections and thought I would see, a few circus artists here and there as part of my practice, but it became a huge part of my career and my professional and still my personal life.
And you do so much great education for other circus PTs, other people working in the circus space, which is really amazing. And I'm sure we're going to talk about that more later, because I definitely want people to know all the different things that you offer so they can get more information, because obviously we have a lot we want to cover in this period of time here. So I want to know what people completely misunderstand about circus performers. What's misunderstood most often?
I think actually what's most misunderstood is what circus is. So, which sounds crazy, right? Like we all have an idea of what in our head what circus is. And it may be different for each one of us, but that's what's so interesting about circus is it's so very broad. So circus can include the sparkly artist in their sequins performing traditional circus, doing a skill for applause. Circus can be in a theater and have very pedestrian costuming and be very open to the audience and conversational and the artist can speak. Circus can be tumbling and flipping. Circus can be walking across a stage. Circus can be the musician that's playing with the artist. Circus can be an actor who is creating a role on stage. So circus has a broad definition. And working with circus artists, as I do, it means that you have to kind of understand all those different components. But the other thing that people often misunderstand about circus is actually that circus performers are just such a small part of who participates in circus. So there is a massive growth, a massive explosion in the best way of recreational circus. And so people like me in my free time. Yeah, I used to be a circus artist, but now I do it for fun recreationally. I have community in circus. I still have that physical challenge from circus. And that is a lot of the people who are participating in circus are people who are doing it after work on the weekends to enhance their lives for physical activity.
I love that. That's so interesting. And what about injuries? What injuries or conditions shocked you most when you entered this world?
Shock is a big word. I don't want to be shocked by anyone's injuries. That's when things have gone horribly wrong. But I do think, what is different about circus and circus injuries is when they occur and kind of the challenges that are presented to the body. So one of the big differences in circus is that we're often working hard at end range of our joints and muscles, which is why it's so appealing for bendy bodies, and why bendy bodies are often so successful at circus. But it's also a challenge for any body, whether it's a hypermobile body or a normal mobile body. But, you know, hypermobility and our definitions of hypermobility. It's just a fun topic we could also, I'm sure, go down a rabbit hole on, but that's not the question you asked me. But in anybody, we're functioning at end range. So our hand balancers and our aerialists all have their arms way up over their heads, and then they're bearing weight or taking traction load. They are loading that shoulder. That's a very mobile joint, again, in any body, and especially in a hypermobile body, and it has to be strong at end range. So we have a lot more presentation of injuries at the shoulder and hip that are chronic in nature. The acute injuries, ankle sprains, all that are like a lot of other sports. But those chronic injuries are happening in a range of motion that not many providers are trained in treating necessarily. So that's what surprised me as a clinician is I was trained in working on the shoulder to do normal household things and typing on a computer and things in front. And I had to extrapolate, how do we take this all the way to end range? And the other thing that's different about circus bodies is in sports in general, we see injuries happening during the competition. So World Cup is coming up, right? These soccer athletes are leaving it all on the field. They're going to be sprinting left, right, center. They're likely to get hurt on the pitch during a match. A circus artist is supposed to look professional, finished, done, in control, or out of control in a controlled manner for the audience presentation during the performance. But training is where they're pushing their body as hard as they can. So we see these spikes in injury happen earlier in the process than we would with a traditional athlete. And it's very true across the performing arts.
That makes sense. That makes a lot of sense. And what's the difference? You mentioned joint hypermobility, which most people who listen to the show know what that means, joints that have greater than expected range of motion. But I also want you to explain the difference between hypermobility, flexibility, and also tissue resilience.
Oh, you're going deep with the big questions today. Because I feel like, especially like the word flexibility, this is a big one.
Yeah, I have no easy questions for you today.
Tissue resilience, let's start with that one, is the tissue's ability to adapt and change and recover from the stresses that we put on it in daily life or in our training, right? So it's our tissue's ability to recover, whether that's in the micro scale of the resilience of being able to come back from a certain movement, or, hey, I had a hard training session today. I need to allow this tissue recovery time to get back to where it was. And ideally, if we're training, it's getting back and building strength and getting stronger. Flexibility. I feel like this one's a tough one because though there are definitions, people argue over what these definitions mean and mean different things to different people. Flexibility is how far the joints go. Ideally, when I talk about flexibility, I personally am talking about how far those joints go with the person under control. Right. So your flexibility, your active flexibility is the range of motion that you can control. Then there's passive flexibility, which may be the range of motion you're able to be pushed into. We need modifiers on the word flexibility to make sure we're all having the same conversation. So hypermobility is going to be when we may have a large range of flexibility. And hypermobility is that extensibility is larger than the average population, right? So you can be hypermobile and have control of much of that active flexibility. So if we talk about flexibility and hypermobility, I want that hypermobility to be a controlled flexibility as much as possible. They're different in that flexibility is a definition of how the body moves, and hypermobility is talking about a joint structure independent of how you're moving it. So, like the joint may be hypermobile, and your flexibility is what you do with it.
Okay, I like that. I appreciate that. And so there's a big difference between somebody who has hypermobility but doesn't have the ability to control that range versus somebody who has hypermobility and they do have the ability to control that range.
Yeah, because as I'm sure you clearly know, we can have hypermobile people that have very mobile joints that are pretty unstable, but they're actually quite stiff. And you can feel pretty locked up and pretty stiff as a hypermobile person because your body's working really hard to hold itself together. And if it doesn't have control through that range, it's often not going to allow the body to go there. So the joint can be hypermobile, but the person can be feeling inflexible.
Yeah, it's really tricky, isn't it? I mean, it makes it hard, I think, for people to get assessed and diagnosed because if you're not a physical therapist or somebody with a deep understanding of how the body moves and you're, you know, trying to assess this person and you go to the very top of the assessment sheet for hypermobile EDS, which is the Beighton score, and somebody might have had surgeries or injuries, or like you said, they're stiff because of the joints, the muscles trying to hold on for dear life and trying to stabilize that joint. So it can make the assessment for hypermobile EDS quite tricky, I think.
Absolutely. Absolutely. And that's what's such an interesting thing about humans and variation across humans, right? I feel like the answer when I was in school was always it depends. Now it's the answer I give everybody else. I'm like, well, it depends. Humans are highly variable.
Right, right. Yes, that's so true. And what do you think the hidden costs are of extreme mobility?
Oh my gosh. I think there's actually quite a few. I think there is a level of awareness and work that goes into everyday movements that if you're not hypermobile, you don't quite understand. And so just walking around and existing in the world is physically more challenging. And I think that level of work to hold the body together, if you are born in a hypermobile body and you're functioning in the world in a hypermobile body, you don't even realize how much more effort you're putting in than somebody who is able to dock their joints and don't have to kind of figure out where that position is or to use their muscles strongly to find that position. So I think it's just that level of constant low low grade thought that we don't even know that is happening.
Yeah, and just because somebody can do something doesn't mean that their body's gonna tolerate it well either, right? Like especially in circus, I feel like people are, yeah, doing things, but it might be something that's very good for their body, but it might be something that is not good for their body.
Absolutely. In circus in particular, hypermobility looks like a big gift, um, but it comes at that same cost. So yes, you can drop into a split. Great. But in circus, for the most part, you're not doing a split on the floor where you're supported. You may be doing it between two people's shoulders, one foot on each shoulder. And if you don't have the strength and control to hold that together, all of a sudden that mobility you can just flop into becomes something like, oh gosh, I am further than I can control versus somebody who has to work for that mobility or that flexibility in their range. They're really going to have to work to get there. And by the time they get there, they'll have the strength to control it. Because for people who have to work for that mobility, especially stretching and structural stretching flexibility that they're gaining is a lot of strength work. And our hypermobile folks have to gain that strength to support the joints that may already be hypermobile. And especially if they're starting young in very mobile bodies, they're like, oh, look, I can put my butt on my head. And it's like, okay, great, 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 great. I'm actually okay with you going there because your body clearly can. So, like, that's wonderful, but not yet. I still need you to walk through the steps that somebody who can't get there has to go through so you can build the strength and build the capacity to do that safely, right? Our hypermobile bodies can bend and move, and that's wonderful and challenging. And what's great about Circus is it can give the tools to control those bodies through those ranges of motion in a way that actually will serve the person in their daily life as well, because it'll make those mid ranges easier because the muscles will be so strong throughout the full range.
So if someone's hypermobile, are you more often having to hold them back and getting them to build the strength to then go back into what they were like able to do, and it seemed like they were able to do it very easily and they want to do it, but you're like, nope, we're going to do this a different way. We're not going to just flop into that position, for example.
Oh, you gave me opportunity to say it depends. Um, um, it depends. It depends on personality. It depends on age. Um, I would say, on average, our younger folks who are less experienced with their bodies are just like, look what I can do. How cool. And I'm holding them back a little bit because they're like, but I can do it. I'm like, yes, but you're doing your handstand with your elbows nearly touching because they're whole so hyperextended. You don't actually have the strength to support your body inverted. And explaining that to somebody is hard. And no matter what their age, whether they're young or older, they're like, but I can do it already. And it's like, okay, but if we hold you back here and you gain the strength, but when you get back to there, you're going to be so much better versus trying to gain the strength where you are is a lot more challenging than taking the steps to get there. But then on the flip side, I'll have other folks that might try to do things. They tend to be a little older, so they have more experience in their bodies. Um, and they're like, whoa, I don't feel safe. Like their body's giving them fear signals of, I'm not stable. And then sometimes I have to push them a little and say, okay, we did the steps. We've done the things now. It is safe. Or let's do it in a really controlled way. But I find myself explaining more often than not that, okay, that feeling of I'm at my end range that you're achieving with your body is sometimes your joint shifting a little bit. And like, can you see that moment? Can you feel that moment? Can we learn to control that moment? Can we push it further and further into your range so that you control it longer and longer? Like the shoulder's a really big one with that. If you go too far in a hypermobile body, it will shift a little bit. So as people bring their arms up overhead, we control the rotation of the humerus, that arm bone. We can change the seating of the ball and socket in the joint. And there's ways of maintaining more congruency or connection between that ball and that socket. And there are ways of shifting a little bit to get less congruency, but then you get more range. So they're like, look how far my arms can go. And I'm like, whoa, your joint can go that far. Your shoulder isn't doing that properly. Let's walk through that process together to get it there. Let's recognize when that occurs, because especially like with things like pull-ups or lowering down from a pull-up, they'll come to the bottom and then kind of shift in the joint to get to that full hang. It's like, okay, you're no longer engaged. What are you going to do next? Now you have to find that engagement again, lifting your body up, pulling your body back together to move on to the next skill versus give you that control through that full range, we can get you to the next place. So there's a lot of education, and some of that education means holding back, and some of it means pushing forward, and some of it is just, hey, I want you to notice this thing that your body does. Can we recognize that? And that is, again, part of the cost of the hypermobility is having to take that extra step to find that. Where as a less mobile person, they would just stop. They're just like, oh, my shoulder doesn't go any further. They don't have to learn that process.
And what do you think about end range for quote unquote, normal people? Well, I'm sorry. I should say non-circus hypermobile people. Let's use me as an example. So non-circus, but also hypermobile people. Should we be training at end range, or should we be trying to strengthen at end range, or should we be staying more mid-range and strengthening more mid-range?
Yes, and I want people to be strong in their mid-range first and expand that range towards their end range as much as possible. Because if you're only strong in mid-range, if let's say you step off a curb and your knee gets a little more hyperextended, you don't have the strength to recover that. So I'd love people to be training through their available range of motion. So yeah, I do want people training towards end range. But if you haven't started doing any kind of strength work, starting mid range, making sure that in the areas that it's easier to control, you're able to control it. So, what people don't always know about how muscles work is that our muscles are better at firing in mid range. We kind of have these little overlaps of our muscles and they have to grab onto each other to slide. They actually like interact like little hand hooks. So in mid range, we've got that nice happy overlap that allows us to still get shorter and you have space to get longer. So when the muscles contract, it's easier. But as you get to end range, those muscles are already having trouble. So it's harder work. So it takes more effort to learn how to get strong there. So getting strong in mid range first is really helpful.
And I'm going to use myself as an example again because why not get a free session out of this? Just kidding. So I spent so many years not stretching because I was in so much pain. And I thought that part of the way to get better was to stop doing any kind of stretching. So when I did ballet, I could do heel in the hand. I could do the splits every which direction, of course, and I could, lay on my back and put my leg next to my ear. I was so flexible. My hamstrings now are so tight or my nervous system is that tight. And I attribute that in part to the fact that I did not stretch at all for quite a few years because I was in so much pain. I had terrible sciatica, and it turned out it was related to this Tarlov cyst, and I had the Tarlov cyst surgery, and then I got a lot better. But meanwhile, I had stopped stretching for many, many years. What do you think about stretching for, people like me, non-circus people, but also let's talk about the different categories, the buckets of people. So there's the people like me that are hypermobile, but not circus, the amateur circus artist and the elite circus artist. And maybe the amateur and elite can be lumped together. I'm not sure.
I think stretching can be really give you another, it depends, right? Like this is, but you gave me buckets. So that's great. So it depends on things. And I have buckets. Great. Um, for our folks out in the general community who are hypermobile, active stretching is my favorite. So if you are going through a range and then actively coming back out of it. So for hamstrings, for example, a weighted or unweighted deadlift. It sounds big, scary motion, right? This is a weightlifter motion. It's bending at your hips, right? It's actually something we do all the time. But if you bend at your hips and come back up, your hamstrings are getting that signal, oh my gosh, I have to lengthen. But I also have the control to come back up out of this. And so it helps calm the nervous system down because the nervous system is going, oh, I'm actually in control. I've got this. I can do this. I can move through this range of motion. So being able to bend all the way down and come all the way back up under your own power, maybe with a little lightweight, like say a laundry basket. Maybe we do this in our daily lives. It's just not like I need to go to the gym and lift 50 pounds, but if you want to and work up to that, that's awesome. Um, yeah, there are people that say don't lift weights for hypermobile people. I am not one of those people. I
Me neither. No, I think weights are
Please lift
huge.
weights. You lift weights in your daily
Please.
life. You lift your child, you lift your laundry, you lift your groceries, you lift your own butt off the toilet. Like we are lifting.
Yes. Yes.
It's those little daily life things. And I think it's even more important for hypermobile folks than the general population because, again, that cost of more work. But stretching. So, yes, so I think stretching is an important part. I don't want my hypermobile folks to sit in a stretch and sit there for 3-4 minutes. That is going to have that tissue relax. Our tissues that are already a little more lax in the first place, those tissues start relaxing a little bit, and the joints are just kind of like, oh, I can just sink into this. And the muscles don't have the opportunity to support the joint the way we kind of need them to. So a little bit of passive stretching is fine. And honestly, the research is showing that short duration passive stretching can work for a lot of folks in combination with other things. So doing a little short duration passive stretch, totally fine, can feel really nice. But holding those long stretches passively, probably not my favorite. This is actually not that different, though, across the circus spectrum. We really want the strength to go with these motions. So, our contortionists, even, yes, they're doing some passive stretching, but they're mostly working in and out of movements. They're working on keeping the leg active as they drop into their oversplit. It is not I'm going to drop into an oversplit and that's the end of it. It's I am working really hard to support myself in this position. I'm going to put my butt on my head, like I was saying before. It's not I'm sitting on my head. It is I am controlling my spine. I am pulling my hips actively onto my head to work to be here. What tends to happen with our ballet dancers when they retire, our contortionists when they retire, is actually that they stop training, they stop strengthening through that full range. And that does tend to make the body tighten up and increase pain. So sometimes, even if you're in pain as a professional dancer, as a professional artist, and you're working at these end ranges all the time, and that's what's causing you pain by the end of your career, which can happen, not always. Um, yeah, you may need to back off. That may be too much load. But there is a certain sweet spot of load where your body is like, yeah, actually, I really appreciate that support through that range. As we come back to like, should I be training at end range? It's like, well, you've been training for years to have it. If you don't have the strength now to maintain that, it's going to be a lot harder for your body to get there. And then there's, of course, joint changes that happen as we age that are separate from the musculotendon systems of that kind of stretching.
Okay, that really helps a lot because I posted this question online and I've gotten such interesting responses from both physical therapists and people who are hypermobile. And people tend to have very strong opinions on this stretching question. So I appreciate that.
And I think some of it comes down to people's neurological systems too, and how their bodies respond to stretch and where they are in the spectrum. The further along I get in my career, the more I lean into the it depends because there is so rarely a right answer to many things. True in physical therapy, true in hypermobility, true in life. Like it's just, there's so much gray. Yeah.
Absolutely. And that's what I love about the podcast because it's really hard, like in a social media post, to talk about the nuances. And most things are fairly nuanced. So I love the ability to actually have a conversation and be able to dive deeper into some of these topics. So another question I had for you is, your fellow physical therapists, Stephanie Greenspan, Iko Callahan, and Annie Squires, who published the fabulous journal article, Management of Joint Hypermobility in Aesthetic Art Performing Artists. And I interviewed them also for the podcast, and we'll link that episode also in the show notes. In that article, they discuss how many circus artists identify with their joint hypermobility. I would love to know if you see that and how can that be harmful and what can be handled about that? And is there an advantage if there's pros and cons to it? I'd love to hear about both sides, but I'd love to hear you talk about this whole like identifying as a circus performer with your joint hypermobility.
Yeah. I think in circus, it's really interesting because there is so much sense of identity related to the discipline of circus and specifically their apparatus or their discipline. During the pandemic, there was also a study that was looking at the artists and their emotional state and their kind of cognitive state related to being away from training and being away from their apparatus and being away from the discipline. And they all identified as, I am a trapeze artist. There's so much personality tied in. I think that happens a lot in performing arts in general, dancers as well. I am a dancer. What do you do on your days off? Well, I prepare for dancing. I make sure my body's ready. I'm always a dancer. And so I think the hypermobility falls into that as well because it can feel as I'm not. So I am a little hypermobile, but I'm not on the EDS spectrum. And when I do circus, I tend to focus on powerful moves and very strong. And I identify as an artist who does big, powerful things with dynamics and swings, and like that is where I live. But a hypermobile mover might identify as I'm a bendy artist. So I do my apparatus, my discipline by putting my feet on my head. And that is how I define my movement in this space. So it's kind of like, oh, in the dance world, like I'm a Cunningham dancer, or I'm a Horton dancer, or I'm a ballet dancer, or I'm, all of these things. And it defines how you move through space. So it's not just the hypermobility they identify with, it's how they approach everything they do professionally. Is I'm going to look at how I can put a back bend into this because that's how I look best performing. Whereas I'm going to go for, I want the most height. I want the fastest flip. And it's just kind of part of the how you represent yourself on stage and as a mover. So I think the pros and cons that come with that are if you can't do that aspect of movement for whatever reason, you're completely redefining yourself. You're not just, oh, but I can still do, oh, I can't put my feet to my head. Okay, but I can still do aerial hoop. It's like, yes, but you might have to completely redefine how you interact with your apparatus. So it is a pro in that it helps you define your movement, define your brand as you're marketing yourself as an artist. It helps you choreograph. It helps you do all that. And a con in that it's also your limitation. And that's not even talking about what's actually doing to the body. It's just the self-perception and the way you move through space.
I love that. And we're going to take a quick break. When we come back, we are going to talk about how to distinguish between normal soreness, overtraining, instability, injury, and things like red flags. So we're going to take a quick break and we will be right back with Dr. Emily Scherb. Summer is winding down, but it is still hot. This is the time of year when everybody deserves better sleep, and Cozy Earth bedding is built for exactly that. The bamboo sheet set, bamboo comforter, and bamboo duvet cover are all made from viscose from bamboo. I love the softness, and it holds up through the late, hot nights of summer and also going into the cooler, hopefully soon, ones coming in the fall. With everything shifting this time of year, schedules, routines, the energy in the house, it is so nice to have one thing that stays consistent. And speaking of cool, I am staying cool right now wearing my Cozy Earth all-day tee. Cozy Earth stands behind everything they make with a 10-year warranty on all bedding and a 100-night sleep trial. If it's not the best sleep of your life, send it back. Everything else is getting back on track. Your sleep should too. Head to CozyEarth.com and use my code BENDY for an exclusive 20% off. That's code BENDY for an exclusive 20% off. And if you see a post-purchase survey, mention that you heard about Cozy Earth right here. So we are back with Dr. Emily Scherb, who goes by the Circus Doc. I want to make sure to throw that in there. I'll put that in the intro, of course, as well. But you can find her online as the Circus Doc. And I would love to know how you distinguish, normal circus soreness versus overtraining versus injury versus instability versus, oh, I wonder if this person has a connective tissue disorder. Just a small question to
Oh,
restart after the break.
just
Just a
a
small
teeny
question for you.
tiny one.
Yeah.
Excellent. Okay, well, let's start with normal soreness. Um, First of all, I want to talk about normal soreness because, what makes it normal? It's normal when it's occasional. If it's after every training session, it's no longer normal. Um, so we are looking for soreness that happens ideally occasionally. If it's more than, I usually say about once a week, you're probably doing a little too much training. There's probably a little bit of overload happening that your body isn't quite ready to handle. And once a week, that's if you're pushing things. So soreness should happen when you have a jump in training. So you're tackling a new skill, a new movement. So that's going to change the stresses on the body. So that may lead to soreness. Or you're increasing the amount of time you're training or the intensity that you're training. So we're starting with the why before we talk about the what. So if your body is sore, it's usually going to happen 24 to 48 hours after training. And it's going to last for around 72 and it should go away. So by day 3, it should be really fading out and going away. Day 1, you shouldn't be sore yet, right? If you're sore as soon as you finish training, also not normal soreness. So We want training soreness to happen about 24 to 48 hours later and disappear a bit after that. And it shouldn't be happening all the time. You should be like, I see why that happened. I started training this new thing that challenged my body in a new way, or I started increasing my training in general. So now we've got more like, so that's normal soreness and kind of what to look out for. It's happening all the time. You're pushing too hard. So pushing too hard, overtraining, there's some lovely yellow flags for that. And this is a tough one because is it overtraining? Is it your body, well, which is still overtraining, but is it your body not being prepared? So not enough sleep, not enough fuel, life stress, our interpersonal world outside of our training, it really does affect how our training itself is affecting us. So we've got a lot going on that goes into overtraining more than just the training itself. And I think with hypermobile bodies, it's easier to overtrain. It's just, again, everything takes a little bit more work. So we do need to be aware of that. So we've got those yellow flags of overtraining, which is I'm sore all the time. I am tired all the time, and I don't feel better with movement, and I don't feel better with fuel or nutrition. I don't feel better getting out in the sunshine, right? With fluid intake, hydration is also huge. Electrolytes are huge for hypermobility. I'm a big proponent. They can make you feel so much better. But yeah, so we're looking for those yellow flags of things just kind of declining or never quite feeling great, or you're never making gains in your training. If you are an athlete of any sort, it doesn't have to be circus, but if you're never making gains and everything always feels like a struggle, sometimes pulling back allows you to move forward more easily. So that overtraining feeling of ick in the body can just be with that low level soreness all the time, high level of fatigue throughout your training session. Those are some nice yellow flags. Also, just being cranky. I know it sounds silly, but being cranky is like, oh, my system is on emotional and physical overload. So I'm a little cranky and a little stressed. Not normal soreness also would be my joints ache. Normal soreness is usually going to be in your muscles. So it's going to be in the middle of like, I'm going to be sore here in my bicep, not down at my elbow or up at my shoulder. That kind of soreness is your joints are taking more of the load. You may feel that more directly after training than 24 to 48 hours after. That's going to be joint soreness. And that means you're pushing things. And so some of my more average mobile folks who are training flexibility work and contortion may have this as they're making progress. But my hypermobile folks are much more likely to have this deep joint soreness and repeated deep joint soreness, even as they're approaching where they're fatigued, either because they're approaching end range or they're just tired from their training session or from life. So they're not able to support their joints. They can start getting that joint area soreness. And that's going to be a not normal soreness. So if that's happening more often than that, that's when I'm starting to think, ooh, hey, are we dealing with a little bit of hypermobility? Some of my hypermobile folks, not all, some, if we make small changes to their training program, have big reactions. So they might be like, okay, I added this one exercise to this one skill, and man, did I crash, like hard crash. Not like I was a little more tired. No, I was exhausted. I was wiped out. And I was like, all we did was add leg lifts, for example. Like we didn't add a big thing. And for a hypermobile body, that might be normal because that's going to send the nervous system into a little bit of flight and fight overload, trying to figure that out. And that can be overwhelming for the neurological system. So if you're seeing that as you change things, like, oh my gosh, poof, I'm wiped out. It's not a problem. It's just a challenge that needs to be overcome. But if you know that that's a thing for you, that can be really helpful to know. And again, I would say this is of my patient population. This is not scientific research. This is just of my personal patient population. That's probably 10% of my hypermobile folks that really have that big reaction to changes in their exercise. And then I have other folks that have other reactions that are unique to different bodies, of course. But that's also not going to be normal soreness, that big crash, that big emotional or neurological crash after changing training. So normal soreness, again, 24 to 48 hours kicks in, 72 hours, it's gone. And that's happening infrequently because we're not overtraining. We're just pushing our bodies gently along this path towards greatness. And soreness that comes immediately afterwards, soreness that's more focused in the joints, or soreness that's constantly there is a more of a little bit yellow flag for me. I mean, that's been going on for a while. We start asking deeper questions.
And you mentioned yellow flags. What are some red flags that make you think this person is probably more than just flexible, or this person may have a connective tissue disorder? This person may have some other problems going on here.
Red flags to me is a, hey, stop, don't go. Like, this is a hard no go. So I really reserve that for more extreme things. So a lot of those yellow flags are going to say there might be a connective tissue component. Let's start asking questions, because I think those yellow flags, that sore all the time, that joint-based soreness, that kind of crashing after activity, um, if we catch those yellow flags, we're not going to get to the red flags. We're gonna hopefully support this person and get them help for whatever it is that's going on. Maybe it's unrelated. Maybe it's an iron deficiency, for example. You know, um, but whatever it is, if that's happening, something's going on in the body, and either their training needs to be addressed, the nutrition needs to be addressed, their whole self needs to be addressed. So those yellow flags to me are when we should be asking questions, or that you should be reaching out to someone to have a conversation, ideally someone who's familiar with the thing that you do with your body. Um, Ideally, they're also familiar, if you suspect that you're hypermobile, that they are also familiar with hypermobility. But if you don't know, if they're familiar with your sport or activity, they'll be able to tell you more definitively whether that's a normal response to what you're doing. Red flags, we're talking bigger things. We're talking maybe you're having difficulty with change of position. Maybe you're getting some heart rate spikes, some of those pop symptoms. I'm going to be like, okay, this is a lot for you to be physical exertion and change of position. Circus, a lot of change of position rapidly. We're talking pain during activity, like pain, not soreness, but like, ow, that hurts. Uh, that's, not a red flag. You're, oh my God, stop doing circus forever. But a red flag, you need to seek care. Like, pain is something you can talk to your instructor about, but you should ideally, if they're like, oh, that's because you're actually sticking your hand underneath your body and crushing it, that's painful in that movement, and that's supposed to happen. Or, yeah, that pain is not supposed to happen there. That's when you go seek care.
Okay. And we know that circus performers also live with a lot of risk, or at least a lot of types of circus. How does that affect the nervous system?
Oh, what a great question. It's a great question. I will try to answer it, but I'm certain there's probably someone who's better at this question than I am. But it definitely, one of the great things about circus, and I'm going to talk about this not necessarily nervous system specifically, but cognitive behaviorally, because that's really where I see it play out. And what we do is, it looks like high risk, and yes, there is risk, but in circus, there's progression, there's drills, there's stepwise steps to get you there, and good training and good coaching. And so, while from the outside it looks like massive risk, from the inside, you're slowly building the confidence, you're slowly building the skill, um, and the risk changes. Your perception of risk really changes. So I'm not talking about the chemicals of what's happening in the nervous system, but I'm talking about how the brain perceives that risk. So at first, something like flying trapeze, right? Terrifying. You're 30 feet up in the air. You're swinging back and forth. All that's underneath you is a net. You're dangling from your arms. That's insane. But as you do this, as you get up there and do it, you realize the strength and control you have. You understand it better, how it feels in your body, where the swing and the pendulum lands you. You understand how you control the different aspects and where your failure points are and how to do them. So, okay, I know when it's safe to let go. I know how to land safely. I understand what's going on at each step and how to make the choice of a go, no go. And so, yes, I'm using flying trapeze as an example, but let's even talk about a handstand. when you're an adult, especially, or a kid, but especially as an adult, and you turn upside down for the first time, it is terrifying. Absolutely terrifying. One of the most risky, brave, amazing things I've ever seen was a 75-year-old learning to do a forward roll for the first time in their life. I looked at this person
Wow.
and I was just gobsmacked, right? I was like, you are my next superhero. That is your vestibular system. You're turning upside down, you're rolling. You don't have that innate understanding of how it's going to work in your body. You have possibly fear from a history of injuries. I was like, you are a rock star, right? So, but a 6-year-old doing a forward roll, we don't think of that as scary, right? So, like, your perception of risk really changes. But even a handstand, for example, like if you're turning upside down and being in a handstand, turning upside down at first is scary. But then you learn, oh, okay, there's baby steps. I can put my hands on the ground and keep my feet on the ground. I can put my hands on the ground and walk my feet up onto something. Oh, look, my hands can hold me. Oh, now I can do that. And as I gain more strength, do it with a little less stability. Okay, now I'm going to learn how to twist out of a handstand to land on my feet, step back down, roll out of it, maybe. Like there's ways of getting out of the handstand that makes the risk of turning upside down less and less and less. So we are actually conditioning our nervous system to be bigger and braver and do more things as we learn that we can control it. So I think of Circus as this great resilience tool where it builds not only um, physical resilience as you gain strength, but mental resilience as you gain skills. So there is a little bit of research out there on the psychology of circus, and it's really cool because it does talk about that resilience that you can build through doing circus. We find that people who've been doing circus longer tend to have more of this mental resilience. And it may be because of this understanding of risk and this progression, those little successes that add up to big successes.
Yeah, and I love that example that you gave because when I was young, I would do, I mean, I never did circus per se, but I did, cartwheels and handstands and forward. You know what I'm trying to say? Like, I would do a number of different, like
Oh,
more
roll. Yeah, you flip
gymnastics
it
kind
and
of. Yeah,
you roll
yeah,
down
yeah,
hills and you
yeah.
do all sorts of stuff.
Yeah,
Yeah.
and you go into back bends and you come out of back bends and cartwheels and various different things. And you don't think anything of it. But when you were describing that 75-year-old, like I had a visceral reaction of like, oh my God, I'm not 75. But I'm like, whoa, that's very, very interesting. What about central sensitization? Do you see that very often in performers?
Oh, it depends. Oh, I know. It's crazy. I do see it. I don't know if I see it more or less than the general population. I don't really know if there's a big difference in the circus population when it comes to centralization. Um, it really does depend on their movement and movement history and kind of their nervous system reaction to things.
And probably their injury history and a whole lot of other things. Are there some performers that are actually too good at ignoring danger signals?
Oh yes. Again, it depends. But there are performers who build that risk tolerance, and there are performers who thrive on the risk. And I described probably the more common pathway of people who are building that risk tolerance as they build their skills. But there's also the folks that thrive on risk and kind of really need that to kind of push themselves and go forward. And so there is a little bit of trying to find that balance of the control and letting go to keep themselves safe. So yes, there's the risk tolerance of danger signals external, and then the danger signals internal. And our internal danger signals, that is something absolutely across the performing arts, but definitely in circus, we have shown repeatedly that circus artists are a little too good at ignoring, to the point where when I talk to my artists, a lot of the times I won't ask if it hurts when you do that, because it doesn't hurt. It just feels a little different, or it feels weird, or what's pain, or what's injury. Pain is when I cannot do the thing, right? It's not always, it hurts when I do this. It's often, I can't do it. So it has to be painful enough to stop them from moving. And then, well, what's painful enough? And that's going to very much vary depending on person. So I think our circus artists do get good at it, partially because it's beneficial. Like, hey, pressure on my body is uncomfortable. There's discomfort in circus. And it's important for the brain to be able to ignore that right? I am hanging from a knee. There's pressure. I'm hanging my whole body weight on my knee, on my elbow. That's pressure. That doesn't feel great. But your brain goes, oh, that's pressure. That's actually holding me up. I can ignore that. That's fine. But then we can start ignoring, oh, I get a sharp pain when I do that, or a sharp sensation. Let's go sensation. I get a sharp sensation when I do that. That's fine. It's only when I do that. Oh, and it's only when I do that. And now that other thing. And now that other thing. And you just can keep ignoring it till you get a little too good at ignoring it. So yes, absolutely. So we have that external risk tolerance. We have the internal sensation. And then we have where the two meet. So, okay, I know that I'm past discomfort. It's a little painful, but my performance partner's relying on me and I need to do this paycheck for tonight. Right. So you have those external pressures and internal pressures meeting, especially in our professional performers, where you're incentivized in lots of real, tangible ways to push through. Sometimes there's an internal pressure of, I want to keep up with my class. I want to keep training. I want to do the thing that's fun. And those are real too. I'm not discounting those. My recreational artists, I'm always having that conversation of them. Where are your values? Where do your goals lie? Let's talk about what the sensations you're having in your body, how risky they are, and what your external pressures are. And then there's our professional performers who are like, I can't seek care because I will lose my job. And you get good at ignoring that. And when you get to a safe space where you maybe can seek care or can take that time, you may not have that same awareness of what's going on with your body. So our brains are really good at understanding signals and then categorizing them as threat or non-threat. And pain is a production of a lot of different signals in our brain. It's not just one thing. And so understanding what's going on in our body actually takes a little bit of practice to kind of hear those signals.
And like you said, there's so many other factors involved, especially if you are a professional, whether you're a professional dancer, professional circus artist. And so people perform through injury, right? This is a common thing. And like you said, they'll keep going until they can't anymore. So how do we can we change that? Is there a way to change that so that people can have, longer careers? And is there a way to change that culture so that people can speak up? I'm sure that it varies a lot. So like if you're somebody who's, very well known, very well respected at a very high level, maybe you can speak up more easily because you have an understudy that's going to fill in for you. And if you're trying to make a name for yourself, it's maybe harder. I would think anyway that it would be harder. Um, whether you're a dancer, a gymnast, um, what do you think people can do? Whether they are the actual artist or the management, what can be done in order to have a safer culture?
Oh boy. Um, big question. I think this is actually currently changing in circus, which is wonderful, at least partially. There has been a shift in the last decade or so to um, to this whole process where companies have been learning that they're able to keep their performers on the road more easily if they provide care for them. Um, there is a little bit of a tug of war with that, in that, yes, they provide care for them, but do the artists feel safe in their jobs seeking that care? Some of that is culture of company. Some of that is culture of the performer. So, especially our older performers who haven't had access before may see, I can seek care while I'm on the road traveling, but what if that's taken into consideration when I come up for my contract renewal? Like they're going to see me as maybe physically weaker and more likely to get big injured, and be off the show. Um, I think our younger performers are, if they're coming up through circus schools that have clinical care on site, which some do now, or if they're used to having companies with care, or sometimes even not, they're more willing if they have a relationship with the provider. And that takes a little bit of time to kind of get through that, where they feel comfortable with the provider. But if they can get to a place where they're comfortable with the provider, they're more likely to be like, oh my gosh, I have an opportunity to get care for that thing I've been ignoring while training because I didn't have the funds to pay for it. So there's kind of a big melange of cultural shift happening in circus with that, where more companies are providing care or helping folks access care, because it probably actually helps their bottom line. But there's also places, I have heard this is about 10 years out of date at this point, which is why I'm going to tell the story, because hopefully nobody can really identify where it is. But there was a circus school that had a physical therapist on staff, and they brought the physical therapist in, and all the students ran to the physical therapist and got care and all this jazz. And the circus school said, well, we never had this many injuries before we had a physical therapist. We should get rid of the physical therapist.
Oh, no. Oh,
It's like, because before what they did was they'd send the students out to get care in the community. So there's a bigger barrier for the students to get the care. So it wasn't, I mean, realistically, it probably wasn't the fact that the physical therapist was there that was leading to more injuries and more use of care. It was probably the fact that they had access to the care. So I think that culture is shifting. That's kind of the culture I'm talking about, is like, oh, we realize that what we're doing is hard on the body, not necessarily in a injurious way, but it needs maintenance, or especially in a training phase where, as I said before, folks get more injured. There's there's more education that has to happen, especially in that training phase, to like, how do you maintain, and what is training load, and how do we make sure that bodies are getting what they need, and is this actual soreness or injury, and that relationship building with providers. And so I think there's a couple ways that we can influence this process and help push it down this road even further. One is something that I am truly passionate about, which is creating more providers who I like to say speak circus. So have knowledge about the vocabulary of circus, have knowledge about the movements of circus. Maybe they do themselves, they don't have to. But the more providers that normalize caregiving and have ways of keeping people active in their sport, the more it's not, I'm seeking care, therefore I have to stop performing or training right now. It's, I'm seeking care and it's enhancing my training and it's making me better. And I think if we bring that back to management, we're bringing that back to that training community, that helps. I think circus instructors and circus coaches, ideally at that training stage, are normalizing seeking care. So there's an education component there that I think starts with having, again, I'm biased. I am a physical therapist. So I am biased, and I'm really thinking about, hey, if we have knowledgeable care, our coaches will feel more comfortable referring their students to seek care and know that that resource exists. So some of it is like, hey, did you know this resource exists? And then on the professional side, it's it's bottom line, it's dollars. So unlike the dance world, there are in the dance world, there are principal dancers, there are names. People know these names and they are probably a little bit more supported. That's less common in circus. There may be someone who's known for a big skill, but the general public isn't really that aware of it. They're just like, ooh, spectacle, beautiful. And so circus artists really do feel replaceable. And there is a lot of pressure to stay in. So I think some of it also comes along with supporting these artists, but companies are still looking at, okay, you got injured. We're going to work with you to get you back because that's going to help our bottom line. But if you stay injured too long, if you get injured again, they won't say that that's what the decision-making process is based on, because they may not even know that it is. But there's at least some subtle thought process of, this person's a financial risk. I might need to replace them in the middle of the show. They're going to cost us more money. Like, that is business. So I think the professional world's a little tougher. But if we normalize getting care earlier, other than those bigger catastrophic injuries, which, I mean, hey, I trip falling off curbs, right? Walking across the street, it's dangerous, but they're going to happen. And they do, but they're going to happen in circus, or they happen in real life. But normalizing care, I think, throughout the entire process. And then, of course, I mean, healthcare systems and having access to care, both financially and physically. So physically having providers, and then financial access to care, which is always a challenge. So I think both and all of those are how we get better care and we keep our artists less injured and performing longer.
Totally agree. I want to ask a question. We're getting close to needing to wrap up, but I really wanted to ask about contortion specifically because, I see on social media and, it looks so painful and or later on, is this going to be a big problem for this person's spine? Um, how do you know if it's safe to be doing contortion or, who can do contortion safely, or at least, life and like you said, I mean, you could get hit by a bus tomorrow, you can step off a curb and get hurt. And so I think all of these things involve a certain amount of risk benefit ratio, right? It's like, do you love it or do you like, I could take it or leave it? But let's say you're somebody who, wants to do contortion. Tell me a little bit about your thoughts on that. Yeah.
Yeah. So contortion comes down to, do you want to do it? How much time are you willing to put in? It's hard, right? People look at contortion, they're just like, oh, those are just bendy bodies moving through space. No. Contortion is incredibly difficult and takes a huge amount of strength, the full range of motion, to be done well. So contortion is a lot of time and a lot of effort and a lot of strength training. And that's what makes it, in my mind, relatively safe when done in that manner because you're building the strength. We will see spinal changes that come with that. There's a flattening of the S curve of the spine. So normally the spine has this swoopy back and forth curve, a little rounder in the upper back, little more concave in the lower back. The cervical spine follows, the neck follows that as well. And as people train contortion, their spines will straighten out, which is something that I see in a hypermobile population a little bit anyway. But in contortionists, we definitely have documented that we see this. Sometimes their curves will actually start to reverse and go the other way a little bit. So there are bony changes. We'll see different stress responses, just like we see in metal workers or glass blowers, right? Like their hands may have a little more arthritis or a little more wear and tear in them. So we may see a little bit more wear and tear in the spine, in the hips, things like that. But otherwise, it's not unsafe. It's just takes a lot of training, takes a lot of strength. And the problems tend to be as folks age that they aren't able to maintain that strength, but they still have a lot of that joint mobility. So it's a commitment. I think of contortion as a commitment. You're lifelong committing to strength training, whatever that strength training means to you. And so there is a lot of work that goes into it, but because they're so strong, they're able to do it. So it's not something you lightly, it's something you flop into. It's definitely something you commit to and train for.
And when it comes to, again, I'm going to come back to social media and, it's so different from when I was growing up. We didn't have social media. People weren't, you know, uh, taking photos and putting them online and videos and all of these things. Um, I worry about it. I worry about what people are seeing because oftentimes they're seeing things that, they're seeing these static images and it looks like, wow, this person's doing this amazing thing, but they might not actually be able to move that well because maybe they can get into these crazy bendy positions, but they actually are really struggling to build that strength like you're talking about. What do you worry about?
What keeps me up at night? Social media keeps me up at night. No, I do worry about it. I think we push with the social media with competitions, and I say that with a little bit of hesitancy because I think there's a lot of good that comes from competitions too. But what are we scoring people on? What are we judging people on? Whether we're judging them by likes and follows on social media, we're judging them by scores on competitions. I feel like we're pushing extremes. It's easier to judge people on how far do your feet go over your head or how big is the skill or whatever. And it's harder to judge on artistry. It's harder to judge um, on the things that I think really push an art form forward. So as a performing artist, that makes my little heart concerned. I want to see the artistry. Sometimes I can watch someone walk across the stage and it's amazing. It's like, or, you see the simple thing and it's just gorgeous. I remember a circus act I saw and they're doing something called sear wheel, which is basically a human hula hoop size thing. And they never once got in it. They just rolled it across the stage and it was just so cool. I didn't realize they didn't do anything cool, until after the whole thing was over. I was like, I don't remember a single skill. I don't think what did they do? And I don't think social media doesn't can't glamorize that or competitions. It's very hard to judge on that the way most things are structured, and I think it pushes human capacity and human limits further and further. But I think it also encourages people who aren't prepared to do it. Kind of like you're saying, like we don't know what that person did getting ready for that moment. Like, is it 2 hours of warm up and rehearsal and training for the last 10 years, or is it I flopped into this, I can't control it, I just did it for the photo, right? So we can't tell. It's hard because what we're talking about is changing societal values and changing how we look at the world. I'm not sure where we go and what we're going to do and where it's going to go from here. But I also think there's a lot of good that can come out of social media and a lot of knowledge sharing as well. So it's a toughie. It's a toughie. And how do we determine what we value? But I think for every individual that's listening to this, it's especially if you're a bendy human, it's taking that control and that strength through your range and not prioritizing the cool trick, but prioritizing the longevity of doing that skill.
Right, the longevity. That's what I really want people to be thinking about is the longevity. So there's probably a lot more moms that are maybe have young artists that they're thinking, okay, how can I help this my young dancer, my young, circus performer, my young aerialist, or they're doing acrobatics or something like that, and they know that they're bendy. They know that their child is bendy. What's the single most important thing that you want that parent to know?
Single most important thing is strength, strength, strength. Strength. And, if you can watch or if you have a conversation with their coach or their instructor or their teacher, whatever you're calling them in that setting, to look out for some of those hypermobility things. In a lot of the sports and activities that we're talking about, circus and dance and gymnastics, they're kind of used to seeing it. And if you help educate them, or ideally they already have the education, like, hey, okay, yeah, they're doing a handstand, but their elbows are really hyperextended. Can we gain a little strength or control there? Because it's going to help their wrists have longevity. It's going to help their shoulders have longevity. It's noticing the things you can see from the outside so that you can start um, getting them stronger to do everything else. So the longevity comes down to strength through all the things that they're doing, and that's often going to be in weight bearing positions. Like you have hyperextended elbows, hyperextended knees. Use them when you're doing leaps, when you're in the air, when there's not pressure on those joints. Gosh, that can make a really cool looking, beautiful line. But when it's in weight bearing, it needs to learn that control so it can control through that full range. So control through the full range using strength. That's how the longevity stays. That's how you can make the most out of the bendy body, whether you want to put your foot behind your head or whether you want to walk across the street. Like having the strength through your full range protects you and keeps you moving.
Yeah, I love that. Having the control and strength through the full range, whether you wanna walk across the street or put your foot behind your head. Yeah, because everybody's priorities are different, and we all have to decide what we want to be able to do, and, that's great. So, as you probably know, we end every episode with a hypermobility hack. Do you have a hack for us? Some maybe small shift that can improve how people relate to their bodies, or something that you wish hypermobile people understood earlier, or another tip for parents or coaches?
I think movement is magic. I think it is one of the most important things we do. So if you're having an achy day, if you're having body pain, if you're having a low mood day, move. I don't care if that's rolling around on the floor. Maybe it's maybe it's rolling around the floor, maybe it's going for a walk, maybe it's doing circus, but movement. Movement can make you feel better, it can lubricate your joints, it can get your tissues feeling happy.
Yeah, I love that because it can be very challenging if you do have hypermobility, and especially if you have a lot of aches and pains, and then it feels like everything that you do makes things hurt worse. So then you start moving less and less, and then things start hurting more and more, right? So then it can be really hard to figure out how can I find that sweet spot of movement. But if you want to be able to move, you have to move, right? So it's
And sometimes it's as simple as starting with like, I am laying on my bed, on the floor, whatever, and I'm going to point and flex my feet. and that's going to rock my body on the ground, and that's just going to stimulate the system a little bit. Sometimes it can be as small as that, but any movement. So my hack is move little, move big, but move often.
Love it. Love it. Can you tell us a little bit more before we wrap up here about what kind of special projects you might be doing, any kind of research that you're involved with, and where people can learn more about you?
Absolutely. So the easiest is probably where you can learn more about me. So I am the Circus Doc on most of the social media platforms, or all the ones that I'm on. So it's the Circus Doc. And you can go to the circusdoc.com to see all the different things that I'm involved in, which are a lot of educational activities for both clinicians and for movers and for coaches, talking about how circus bodies work on the ground and in the air. And then I also host symposium and speaker series where I bring in specialists and researchers to come in, kind of like this podcast, and talk about the amazing work that they're doing with the goal of getting research and knowledge disseminated into the population and actively engaged with faster. The average uptake time of research to practice is 16 years. And if we can shorten that gap, we can help a lot of people. So that's the goal of the speaker series. And then I do a lot of research, translation just in newsletters. So if you're interested in circus research and body research, please join my newsletter. And again, you can do that at the Circus Doc. And then my own research, I'm involved in a couple projects right now, doing some things on shoulder strength testing for return to circus. Lots of little ways and things.
Yeah, lots of things. And you were kind enough to invite me and Dr. Brooke Winder to your last speaker series, which is what led me to. I pointed out to people, "Oh, go listen to the interview with Dr. Scherb," and then I realized, "Wow, that's 6 years ago. We need to have an updated conversation." So, yeah. So thank you so much.
I always love getting to sit down and chatting with you.
Yeah, this is great, and I feel like clinicians understanding circus and what circus artists do is something that can really help so many people. We have so many sports medicine doctors, right? We have so many for other types of athletes. So I feel like, being able to offer that same kind of care to circus performers and dancers. Of course, we have dance medicine for that, but circus medicine, I'm so excited to see that field growing and expanding, and you're such a big part of that. So thank you so much for all the work that you do and for coming on the Bendy Bodies podcast today.
Thank you so much for hosting me. It's always a delightful conversation with you, and talking about hypermobility is one of my favorites.
Thank you so much for listening to Bendy Bodies. We really appreciate your support. It really helps the podcast when you like, subscribe, and comment on YouTube, and follow, rate, and review on all audio platforms. This helps us reach so many more people and spread the information to everyone. Thank you so much again, and enjoy the rest of the episode. Thank you for listening to this week's episode of the Bendy Bodies podcast. If you'd like to go deeper, I share additional education, clinical insights, and resources in my newsletter, The Bendy Bulletin, which you can find on Substack at hypermobilitymd.substack.com. You can also help us spread the word about connective tissue disorders by leaving a review, sharing this episode, or sending it to someone who needs it. These small actions truly make a difference in raising awareness about these conditions that are still widely misunderstood. And don't forget, full video episodes are available every week on YouTube at Bendy Bodies Podcast. As many of you know, my passion is helping people better understand and navigate symptomatic joint hypermobility. In addition to my clinical and educational work, I offer one-on-one coaching, professional mentorship for healthcare professionals, and expert witness services. If you'd like to learn more, please visit the services page at hypermobilitymd.com. You can find me, Dr. Linda Bluestein, on Instagram, Facebook, TikTok, X, and LinkedIn, all at hypermobilitymd. As part of our collaboration with the UVA Health EDS and Hypermobility Disorders Center, we also want to share a few helpful resources. For questions or appointment inquiries, you can contact them at ruvaedscenter@uvahealth.org. That's the letter R, UVA EDS Center at uvahealth.org, or call 434-243-8200. Our incredible production team is Human Content. You can find them on TikTok and Instagram at Human Content Pods. We love bringing on guests with unique perspectives to share. However, these unscripted discussions do not necessarily reflect my views or opinions. Furthermore, perspectives, expressed within Bendy Bodies media, including this podcast, do not reflect the views or opinions held by Human Content Inc. Although we may share healthcare perspectives on this podcast, no statements made on Bendy Bodies should be considered medical advice. Listening to or watching this podcast does not constitute a doctor-patient relationship. Please always consult a qualified healthcare provider regarding your own care. For information about the Bendy Bodies program disclaimer and ethics policy, submission verification and licensing terms, HIPAA release terms, or to get in touch with us, please visit bendybodiespodcast.com. Bendy Bodies Podcast is a Human Content production. Thank you for being a part of our community, and we'll catch you next time on the Bendy Bodies Podcast. Thank you so much for watching. If you enjoyed this video, give it a thumbs up and leave a comment below. I love getting your feedback. Make sure to hit that subscribe button and ring the bell so you will never miss an update. We've got plenty more exciting content coming your way. And if you're looking for more episodes, just click on one of the videos on the screen right now. Thanks again for tuning in, and I'll see you in the next episode.